really personal or detailed questions, because we won't really be able to answer those, certainly not during the panel discussion. So now I'm very pleased to introduce to you our moderator for this evening's program, Dan Lothian. He is an award-winning television news journalist, and if you don't believe me, you can check out the pictures of him in action up there. He spent more than a decade as a correspondent at CNN, and the last 5 years at the network as a White House correspondent. And in that role, while covering the White House, Dan traveled with President Obama to more than 30 countries, including his historic visit to Myanmar. Dan joined CNN from NBC News, where he worked for 7 years as a Los Angeles-based correspondent. He covered breaking news across the West and Mexico, was dispatched to Cairo after 9/11, and he spent several weeks based in NBC's Tel Aviv bureau. Before spending more than 17 years on the national stage, where you may have seen him many, many times, Dan worked at top local stations across the country in Boston, Seattle, West Palm Beach, and Chattanooga, where he began his television career. Dan is now the founder of Little Park Media and is a contributing editor, a contributing correspondent for the PBS show Religion and Ethics News Weekly. Dan Lothian, welcome, welcome, welcome.
Thank you. Thanks so much, and it's a pleasure to be here. Every time I look at that photo of me with that helmet, it looks a little odd.
It looks like it's on backwards.
It does. And actually, I was very nervous because we were taking off to fly into the green zone in Iraq, so that's where that's from. But my daughter's always Googling and pulling up pictures, and that one always comes up, and I have a good chuckle. Anyway, a pleasure to be with you folks, and again, welcome to all of those who are here in person and all of those watching on Facebook Live and live streaming. We have a great panel here this evening, and I look forward to learning a lot more about radiation and all the therapies that are out there. But let's begin by introducing Dr. Michael Zalewski, right to my left, Chief of Brachytherapy Service at MSK, Professor of Radiation Oncology, Vice Chair of the Department of Radiation Oncology and Clinical Research. He is internationally recognized for his work with external beam radiotherapy. He's also a leader in brachytherapy for the treatment of prostate cancer. Dr. Daphna Gelblum is Director of Regional Oncology and Clinical Research. She's a radiation oncologist who has spent 20 years here at MSK. Her work focuses on delivery of intensity modulated radiation therapy and image-guided radiation therapy. Dr. Christopher Crane is Vice Chairman of the Department of Radiation Oncology at MSK. He specializes in caring for patients with gastrointestinal cancers, and he is also chairman of NRG Oncology's non-colorectal GI committee. And then finally, Margie Hunt. She is chief of clinical physics service at MSK. She's a New York State licensed medical physicist who's worked here for 30 years. Congratulations. She ensures safe, accurate, and consistent care while also promoting research and development in new radiotherapy techniques. Again, welcome to this esteemed panel. One of the things when people are diagnosed with cancer, there's just so much that they have to process. So many options, so many things they have to think about. And when we're talking about options, radiation is no different. There's so many different kinds of treatments, from external, internal radiation to image-guided radiation to stereotactic radiosurgery, which is an intense dose and highly targeted form of therapy. So I want to begin first with the external beam radiation, and Dr. Crane, to you, can you sort of flesh that out a little bit for us? Explain to us what that is, and why are there so many options?
So external beam radiation is one of the most commonly used cancer treatments. It's a local treatment like surgery, as opposed to chemotherapy, which goes all over the body, and it's used to help cure patients who have cancer, and sometimes it's relieve their symptoms. It is high energy X-rays that penetrate into and sometimes through the body that cause changes in the DNA or the genetic structure of cells that lead to cell death. Sometimes those changes are repaired in the normal tissues, and sometimes they're not in the case of tumors, and then the cells will die and shrink and hopefully be cured.
And when we're talking about all the options here, is that better for patients that you have? Sometimes too many options can be a little bit overwhelming, but what's the advantage of having so many options?
We have developed many different options, and all of them are to overcome certain limitations that we have and to help patients have better outcomes. The tools that we use end up having certain funny names that are hard to understand, but they're basically either intended to increase the radiation dose and produce better outcomes, or to spare the normal tissues and lead to lower side effects.
Now, you touched on X-rays there a few seconds ago. Can you walk us through some of the main techniques used in external beam radiation?
So the two broad categories that you'll hear about are X-rays, or external beam radiation that we've been talking about, and protons. The difference between the two is that X-rays go all the way through the body, and protons go into the body and stop. The things that you'll also hear more about are image-guided radiation, and that's to use some form of imaging, whether it be just an X-ray or a CT scan or even an MRI scan, to guide the radiation and make sure it's pinpointed accurately. That can be used with any type of radiation. And then stereotactic radiation uses the image guidance as well as sometimes focusing on controlling the internal organ motion. That is, all of those factors are used to pinpoint the radiation, usually in smaller tumors, and deliver a dose of radiation that's more likely to result in complete eradication of the tumor.
I'm certain one of the questions that people either in the audience here might have or at home is, what disease can this be used for? And I guess I can open this up to anyone here. Is it a number of different diseases or something in particular that this kind of treatment can be used for? Anyone?
Well, in general, for external beam radiation treatments, for most solid tumors, radiation has been used effectively, and especially when these tumors, as Dr. Crane had mentioned, are localized and had not spread. These focused kinds of treatments could be extremely effective in eradicating the cancer cells. And as we've mentioned, there's so many different forms of radiation. These have evolved over the years, where over the last 15 and especially 10 years, we are now so much more focused than ever before. We're incorporating imaging to help us pinpoint the tumors so that we can target these so accurately and treat less of the normal tissue this way. And so that's what image-guided radiation about. It's just an enhanced form of this external beam radiation. And then when we even want to treat these exquisitely small tumors but near very sensitive normal tissue structures, that's where we use the stereotactic radiosurgery to pinpoint and give extremely high doses.
So my guess is then over time, as treatments evolve, you're learning a lot, right? And you're seeing that maybe things that you wouldn't have used it for in the past, you will now.
It's a dynamic field, because what I remember being here 25 years ago, the way radiation therapy was conducted is so vastly different than what we have as huge opportunities nowadays to treat cancers.
Margie, I want to bring you in on our next question. We're seeing such an explosion of new technology when it comes to radiation treatment. What has that really done to the field?
I think, as Dr. Zalewski said, compared to 25 years ago, radiation treatments are nothing like what they were. The accuracy with which we're able to deliver treatments is really pretty incredible. Linear accelerators can deliver radiation to within half a millimeter in a patient. That's thinner than a credit card.
And you use the term what? Linear accelerator?
Linear accelerator, which is what we use to deliver X-ray therapy that Dr. Crane was talking about.
Okay.
But the technology that has come into the field, the imaging technology, the technology to deliver radiation is really pretty incredible.
Right. And so, it's hard to kind of look to the future and say, where are things going? But are there some just innovative things that will, when you look back at how it's done now, that you may say, wow, that's how we did it then? I mean, is that kind of where it's headed?
Yeah,